Yes.
Yes,
Okay.
yes.
Welcome, everybody. I'm very, very happy to start the second section of Ask the Experts. And we're very fortunate to have two great experts. This is our opportunity to really ask our questions, get updates from field professional and feel together. So, of course, I thank American Friends of Soroka Medical Center for hosting this and making it possible. And I'd like to present the Executive Director, Rachel Heisler, to present our two distinguished speakers today. Rachel?
Hello, everybody, and welcome to our Soroka Friends Ask the Expert video conference. We're thrilled to be able to create this safe community where friends of Soroka from all around the world can gather together virtually and hear from truly world-class experts to help us best deal with the global health crisis we are facing today. Please message all of us if you'd like to receive invitations for future meetings. So this series was initiated to share our experiences at Soroka Medical Center, where thanks to the leadership and close cooperation with Israeli government, we were able to respond in record time. We opened a special building apart from the main hospital at Soroka, where over 400 people are tested daily for COVID-19, and we can accommodate at the moment 55 patients. And of course, we'll respond to the need as situation evolves and add capacity if necessary. We're so proud and we are confident that the innovation and science that's embedded in our COVID-19 unit is going to serve the residents of the Negev very well and also serve as a role model for global health. So safe to say, none of us have ever seen or experienced in our lifetime anything like this before. We're all on edge and anxiety is rampant and we're wondering how best to deal. So our approach at American Friends of Soroka is to come together as a community, seek expert advice, and add in a dash of humor. And we're bringing all of that to you today. A safe space to hear from experts and ask our questions. So our two experts that are joining us today are Dr. Yitzhak Ben-Zion and Dr. Teresa Rosenblatt. Yitzhak, or Zahi Ben-Zion, is a former deputy CEO of Soroka. He's a psychiatrist and a sexologist. He serves as the chief psychiatrist for the Southern District of Israel and is the chief of sexual health medicine at Soroka Medical Center and at the medical schools of Ben-Gurion University. Dr. Teresa Rosenblatt is a psychologist and psychoanalyst who practices in Scarsdale and Manhattan and provides therapy for adolescents, adults, and couples experiencing anxiety, depression, and facing a range of personal issues. She's a graduate of Barnard College and the Furkof's Graduate School of Psychology at Yeshiva University in New York City. Her book, The Voice of the Analyst, demonstrates the importance for mental health professionals to develop a unique identity that reflects their character and their training to maximize their connection with patients and help them achieve their mission to ease human suffering. So with that, welcome again to all who have joined us and let us begin.
Thank you very much. So we're going to start with a brief 2 to 3 minute each. We'll take the time and give us an update and their own professional perspective of the situation, along with some thoughts and tools and tips. We're going to start with Teresa, and then we'll go to Dr. Rosenblatt and then Dr. Ben-Zion. Dr. Rosenblatt, please.
Hi, everyone. And I just want to add one quick thing to my bio because it was 10 years of training, which was I'm also a trained psychoanalyst. So I'm delighted to be here. I feel very lucky to have the job and the training that I do because I feel like I can really make a difference in people's lives in terms of their mental and emotional health, and even that trickles down into physical. And I feel very grateful to be on the board of the American Friends of Soroka and to do whatever I can that leads to any kind of support that Soroka can get, and hope everybody keeps Soroka in mind all the time because they have a double layer of problems to deal with that we don't in the US. So first I want to talk about common challenges during the time of COVID-19. So problems that you had before Soroka can get accentuated during social distancing. You may have more pressure on you than before and be without your usual solutions.
I'm going to share the screen. okay? With
And this
your,
is true for everyone, as we've now seen with Boris Johnson and Prince Charles. This disease is a leveler. It doesn't discriminate based on class, money, or power. There can be loneliness, isolation, and fear. There is sardining, being squeezed together with family members, and relational problems become magnified. You can get cabin fever and boredom. There's no expiration date on the situation, and we feel helpless and frightened. We can experience loss of function, of purpose, structure, and routine. These are the things that kept us regulated, sane, and happy. There can be disagreements with one's partners, leading to tension within the couple when one partner is less vigilant and strict about social distancing and sanitizing. Parents, mothers especially, and especially even working mothers of young children, are overwhelmed, resentful, and sad. Now, I'm not saying that these things apply to everyone, but I also want to add, I've been compiling these observations based on both myself, but also keeping up a full-time practice through phone and video sessions, friends, relatives, and everyone. It's coming at me all the time. Also, substance dependence and abuse becomes really challenging at this time and can very much be intensified. So those are the challenges, but now for a more positive spin, I want to talk about tips and guidelines for mental and emotional health during this really trying period. And again, these are things that I've developed both from my own coping, which I'm doing pretty well. So it's really made me think about it, and also talking to a myriad of patients, some of whom are absolutely hysterical and others are managing pretty well, and then a lot in between. Survival depends upon adaptation. That's Darwin, right? Adaptation of the fittest, survival of the fittest, adapt, make a new normal, be here now. Don't think about what if only I had my own life. Practice social distancing, but emotional closeness. I'm quoting Governor Cuomo there. Love the way he put that. Try to resolve to call or FaceTime at least one person a day. I'm lucky because I'm interacting with patients all day long and having a lot of really rich, meaningful personal interactions where I can make a difference. But even after all of that, I need to speak to a friend, and I do. Do things that give you purpose and pleasure. Exercise gets those endorphins going. It makes you physically stronger, builds your immune system. It just feels good. Get as much daylight as possible. Take a walk outside. It's beautiful now. Regard this as an opportunity. What are things you can do now that you couldn't do before? I'm getting more sleep because I'm not commuting all over the place. Also, a lot of people are actually connecting more. They have more time to spend with friends. Make a deliberate effort to figure out what might be a positive in this new normal. Do something for yourself for sure. If you want to watch more Netflix, whatever you want to do, but do something for somebody else as well. There's research, lots of research that shows that pro-social behavior makes people happier. People with substance dependencies should call their psychiatrists and either add to their prescription medications, change them, enhance them in some way. For those people with substance problems who are in recovery, now is a time to lean on your sponsor or anybody in a similar role more than ever. And finally, either continue seeing your therapist or start seeing your therapist if you're struggling. All therapists are now working online or on the phone, and I am astounded by what rich and productive sessions I'm having with my patients that way, and it's really helpful. And that's it for now.
thank you very much. I'm gonna stop sharing and come back to you. So thank you very much, Dr. Rosenblatt. And now to you, Dr. Ben-Zion, if you can tell us a little bit of what's going on your side of the globe.
So, good morning and Shabbat Shalom on my side. I am situated in the garden of my house in Omer, near Beer Sheva. And for us, the evening is already, the Shabbat evening is coming. In Israel, the things are more tied up. There is not a complete blockade, but you are not allowed to go to the street. Most people, if I want to go out, I have to wear my doctor's sign, and we are not allowed to go to more than 50 to 100 meters from your house, just to take a little walk and then to go back. In Soroka, we have, as was mentioned, we have a new very big Corona department. We have now 15 people in it. Unfortunately, 2 are in a very bad situation, and 5 are in, in the middle. We lost 1 patient who was very old, with a lot of other diseases, diabetes, hypertension, and so on. And she was hospitalized for a couple of days, and unfortunately, we couldn't help more, but many of the people that were hospitalized are now released, and this is a good sign. Israel is now adding between 1,000 and 2,000 new tests a day. That means in the beginning we had problems with doing the Corona tests. Now in Soroka we established our own laboratory, and we get lots of help from the Ben-Gurion University, medical students, biology students, students that have knowledge of doing laboratory work are helping, and we do it around the clock. Our medical students in Soroka, we have like a drive-in in Beer Sheva, outside in the skirts of Beer Sheva. You have such a drive-in clinic that people come with their car by their own, they get the test and they go, and after 6 hours they get the result. And all of this is run by volunteer medical students. Part of the nice thing in being in Israel that everybody is working together. It's real, there are real closeness, Bedouins, Jews, people that are from all different things, pharmacologists that are not in the pharmacy, but they are working in the university, come and help with the pharmacies. So everything is building up, and as you know, in Soroka we have a lot of challenges, because we have a lot of people who are deprived from in many areas, and we have problems with them, just if they need medications, if they need more tests, we have problems with that. And all of this is done by volunteers that help us to bring it along. Now, as to my profession, I think that Teresa summed up most of the things that I wanted to say. The only thing is that I think that we have to bear in mind that we are not all going to die. A lot of the problems, if people are just watching the TV or going to the newspapers, it looks like doomsday. And it's very important to bear in mind that most people, 85 to 90% of the people, won't be very ill from this disease. The nice thing about it is that we all are collecting together, so to prevent the very old or the very unfortunate with a lot of other diseases to catch this kind of very severe flu. But most of us, if we catch the virus, won't be very, very sick. And this is important to bear in mind, because a lot of the time, because of the empty streets, it looks like Yom Kippur. It looks like that everything is shutting down, and this is not the situation. There will be a couple of weeks, and things will go back. It's a pandemic. It's not a nice thing. It's a new experience. But as Teresa well said, what won't kill us will make us stronger. So we hope. It's a time to love. It's a time to share. It's a time to discriminate between being cautious and being fearful. It's not the same thing. We have to be cautious, but we don't have to fear. And I just want to finish with the story that my grandfather always said, that there was a big pandemic in Baghdad, in Iraq, and 15,000 people died. So the rabbi of Baghdad goes to the street, and he sees, all of a sudden, he sees the angel of death. So he said, he speaks with him. He said, how did you kill 15,000 people? So he said, no, I killed just 5,000. So he says, how is it possible? 15,000 people were dead. So he said, I killed just 5,000. The other 10,000 died from being scared. So this is the thing with the COVID-19. Most people are very scared from it, but most of us don't have a real a need to be fearful. So we have to be cautious, but not fearful.
Thank you very much. I would actually like to express a question that was asked privately here, anonymously, and that is, if someone does have the symptoms and does feel that they have a real reason to be fearful and worry, and they sit at home, self-quarantine, what type of things can they do in order to have some positive thoughts about the situation if nothing seems positive to them?
Teresa, you'll want to answer that, and I'll add
I
to
think
you.
that I don't have a magic bullet answer. I have an answer, but not a magic bullet one. The first thing I want to say is that there's nothing that I'm recommending that I think is easy. You know, I listen to people with what they're struggling with all day, and when, you know, we talk about a possible solution, you know, there's a lot of I can't, but this, but that, but the other. None of this is easy, and it does require effort, and it does require making a deliberate effort and doing something differently. And I think you have to just tell yourself, okay, I can try hard. I can, and it will be hard, but I'll be okay, even though my efforts will be difficult and maybe not natural. Number two, the challenges that I mentioned were sort of a compilation of what I'm hearing about over and over again, but there's one that I hear from every single person: the open-endedness of it, the not knowing, when is this going to end? Or I'm sick, but I'm not sure what's going to happen, or whether I really have COVID because I haven't been tested. That is very, very hard for people. I think maybe one thing you can do, as Dr. Bension, am I pronouncing you correctly?
Yes.
Sorry?
Dr. Bension, that
Yes.
one thing is to refer to what Dr. Bension said, is remind yourself of the facts. Most people, the vast majority of people, are going to be fine with this. And if you find yourself unable to even tolerate that, be in touch with your doctor. Have your doctor, through the telephone, monitor your symptoms so that you know that somebody who's knowledgeable has a virtual, in a way, eye on you. And the other thing is, there's a bit of a phenomenon that happened during 9/11 in the US, which is they kept replaying the videos of the towers falling down over and over again. and it added to the trauma, and little kids actually felt like it was happening over and over again. When you tune into the news, you hear the same information over and over again. Occasionally there's something new. And what happens psychologically is you feel like there's, like bad things are happening over and over again. Whereas when you really think about it, a lot of the facts about the course of the illness remain the same. And you need to just remind yourself of those few simple facts.
I cannot agree more than what you say. You know that before 9/11, in order to make the diagnosis of post-traumatic stress disorder, PTSD, it was said in the book that you had to witness it. But after that, they changed it if you also if you witnessed it on the TV or online. So now we see a lot of people, they are getting post-traumatic stress disorder, PTSD, from just watching the TV of terror acts and so on.
Yeah.
And one of the problems is that the TV channels don't have something new to say most of the time. And they have to fill the gaps between the commercials. So they give it again and again. And people get there's a psychological system called deja vu. I've been there already, and people see it again and again, and it like melts the opportunity to deal with things. And there is no catastrophe really, but if you see Italy, and they show you again and again all the coffins, and they show you again and again the doctors and the machines that there are not enough machines and so on. So people get into their head, oh my God, I'm going to die. And this is not true. We are not going to die. Most of us won't get the disease. If we get the disease, most of us will feel a little thing. And a lot of people are just spreading the virus without any symptoms at all. This is part of the idea why you should stay at home. But that's it. Okay, it's not such a risky business for most of us. And this is a thing to bear in mind. One of the problems that people are alone at home or with people is not just that you have to bear now your mother-in-law or your spouse or your children, is that you have to be a lot of time with yourself. And being with oneself for too long is a big issue for many of us. So the thing is that we have to understand that part of being scared is because we meet ourselves and we meet our fears just in front of us. Another thing is that, another trick that I think that I tell my patients is to write down your thoughts, to write down your worries, and then to throw them into the basket. And to remind oneself on every day at least three things that you want to be thankful for, that you want to thank to good things that happen to you. And that another thing is to look back and to see problems that you had and that you thought that are unbearable and that you got out from. We are now before Pesach. There is a saying in Hebrew, we went through Pharaoh, we'll get through this too.
May I just add to what you said? The thing about the PTSD is really true, and literally one of the ways that we can get one way we can get PTSD is having our own trauma, but we know that it's traumatic to witness bad things happening to other people. So when we see the scenes of Italy and etc., that is a form of a trauma. And, you know, with the news, and we all want to keep up with the news, and I think having the facts and having news is critical, but tell yourself you're only going to watch once a day or twice a day. Get up in the morning, see what's new, and then check in again in the evening, or only do it once. And that's all you need. And, you know, your point, doctor, about being stuck in your head and meeting your own thoughts is so important. And when I said walk outside every day or go to your backyard or wherever you can go to open your door and get outside, even if it's limited, part of it is for sunlight, but part of it is to get out of your own head and reaching out to another person. We know that people bear trauma better when they have support. We know that people can get through horrific traumas when they have good support. So do reach out in whatever way works for you.
We know from our experience with the Gaza Strip, you know that Soroka gets most of the casualties coming from the Gaza Strip, unfortunately. And there is a thing called resilience. People who are in a good community, people who have good families, good friends, that are doing good things for other people are getting resilient. Resilience has to do with the possibility to look at things and to say, well, it's a difficult time, but we'll get through it, okay? It's also an opportunity. It's not just a bad thing. And we should bear in mind that if we wash our hands with usual soap and warm water, this is the best thing, even if you touch something, even if somebody went near you and he has the virus, if you wash your hands with soap and warm water, you don't need anything more than that. But people are feeling that they're losing control. I don't know how it goes in New York, but here in Israel, there was shortage of toilet paper. Okay, people went like if they are going to the toilet all day long, like people bought hundreds of toilet paper. And I think that the thing is, and people ask me, why do people need so much toilet paper? Because it's a thing that you can buy and you feel in control. I have something, I did something to control the coronavirus, but and it's something, it won't rotten, it's okay, and I have it in my closet. But people are and there was shortage of it, not because there is a shortage of toilet paper, it's because it's a big thing, and it took time to put it back on the shelves. But people got crazy, and people were buying hundreds of dollars worth of toilet paper.
Thank you very much, both of you. So moving into the other side of the coin, the good relationships, nurturing our relationships with loved ones, especially when we all know we're nervous, have anxiety, stress level, maybe lack of desire. Give us a scenario or some tips of how we can actually have a nice romantic date here at home with our loved ones, our partner. You know, how can we approach if we don't feel the desire?
Teresa, or I will, Teresa, you want to answer that?
Let's start with Dr. Benzion, the sexologist, the director of the Clinic for Sexual Health in Soroka.
Okay, so I tell you like that. First of all, if you want to make love, not everyone is into that, but if you are into it, it's a very good and positive thing. One thing is to dress up. A lot of people want to begin things with their pajamas, okay? It's not a good idea. You have to dress up, you have to put the makeup, or guys should shave if they are shaving regularly, and you have to prepare to wear. And I think to make time. Desire is not a yes or no question. You can make desire come. I give always the example of coming back home with something that was like with a bottle of wine that you didn't want, when you went to the supermarket, you didn't want to buy it. But you come back with it at home because someone made you the desire for this wine. They show you it's a good bargain. Someone gives you a taste of the wine. They explain you that this is the best wine now possible. So they make the time, they make the scene so that you will desire this bottle of wine. The same thing is with sex. And a lot of things it's not just a time for sex, it's time for touching, for giving a back rub, for caressing. It's not the time to make new positions from the Kama Sutra. This is not, if you are into it, and the couple is, I'm very much, a lot, it's a good thing, but most people are not into that. But make an appointment, make the scene for things, and a lot of time you have to discuss. A lot of the problem is that people are not discussing. People are not telling what they want, and they are not telling what they need, and make to make room for things is a good idea. Another thing is that people are thinking that because they are together, they can mind read one each other, and this is not the situation. And this is not the time to change things. This is not the time for making make quarreling about things that you didn't have the time to quarrel before. It's not a good idea now to make couple therapy by yourself. A man who has himself for a therapist has a fool for a therapist, and so with a couple. If a couple have a problem, go and see someone. Don't try to treat it by yourself.
So I agree with everything that Dr. Ben-Zion said, and what I would add is starting with the sort of top layer. I absolutely agree, both for the health of the couple, but also your individual health. Get up in the morning, get dressed, groom yourself, and you can get so kind of enmeshed in our little petri dishes at home with our partner and our family that you can start to sort of almost not see the other person. But remember that whatever you do or don't do has an effect on them. And that goes for more than dress as well. Be extra considerate, which is something that to your partner, which is something that can fall by the wayside when you're, in this kind of enclosed space. But think of them in terms of sharing the space. And, my husband and I are both working and we're on phone calls, and we need to, be mindful of who has what space when, and the sound of our voices. So be very mindful. Another thing is I work with a lot of individuals, but I work with a lot of couples as well. I tell them when issues of desire come up, and often it's about the woman, but it applies to men too in a different way. Desire starts 6 months, or what's the word? I forget the word, but getting in the mood starts 6 months ahead of time. Okay, we're not talking about 6 months now, but invest in the relationship. If you invest in the relationship, in the intimacy, talking, as Dr. Ben-Zion says, being good to each other, if you're both thinking about the other one, you're going to come out ahead. And desire comes out of that, especially in a long-term couple, more than just the immediate physical. If you invest in the intimacy, sex will come out of that. But the other side of the coin is, in the hierarchy of needs, when we're feeling under existential threat, sex is not the top priority very often. So some people might go to sex as an anxiety reliever, but for the majority of people who are also worried about their income, by the way, they're worried about their health, their mortality, their income, being out of touch with close family members, vulnerable family members. Sex may fall to a lower priority. And the problem is when there's a difference in desire in the couple. When you both have the same high or low or medium level of desire, you're cooking with gas. But if your partner wants more and you want less, or vice versa, that's when there's friction. If you're the one that wants less, explain to your partner why that is. Let them know that they're not being rejected. It's not about them. but you're so tense. You have a pit, you have a ball in the pit of your stomach, and it's interfering with your desire. And be kind and respectful to each other. And you can cuddle, you can find other ways of intimacy. If you can do that, the desire will come back when the tension level comes down. But
We
be
have to
good to
remind,
each other.
I cannot agree more than that, but we have to understand that sex is not just intercourse. Sex, most of what people are doing in sex is outer course, is caressing, is hugging and kissing. So as we tell our children, many times children say, I don't want to do this, so don't tell me what you don't want, tell me what you do want. So the thing is, as you said, Teresa, very clearly, I cannot agree more, being patient, being kind to each other. This kindness, patience, patience will keep the patients out of the clinic. Being patient, being kind, doing things for each other. Many times I don't want things for myself, but I will do things for you. The same as if I'm not hungry and you're hungry, I'll prepare some, I'll cook something for you. It goes the same with relationship. Being kind, being patient is the keystone for getting this whole mess. And another important thing that I want to say is that being abnormal in abnormal times is the normal thing, okay? Like behaving like nothing has happened, nothing is happening, this is not normal. Like being tensed, being with the stomach in the ache, being with the globe in like cannot, something is sticking in your throat. This is the normal situation, not the abnormal situation. It's abnormal times, and in abnormal times, being abnormal is the normal thing.
And
Thank
may
you.
I add,
Yeah.
the business of putting things in words is very important. And that's another thing that we can take for granted when we're in a couple and we're so, intimate. We do think that the other person reads our mind. And some people actually expect that. They think that's part of a good relationship. There are no two people who are exactly the same. Take the extra effort and say to your partner, I hope you don't feel that I'm ignoring you right now, but I'm preoccupied with this, that, or the other, or whatever. Put it into words.
Yep.
Thank you very much. Before we open, there's another anonymous question here in the chat. It's a private question. What do you do when you're a caretaker? You can be a caretaker in your job. This person is a registered nurse, or you can be a caretaker at home, traditionally, among your family. You take care, everybody's used to you taking care of others, and you really put your needs on to the side, especially the growing anxiety and fear of getting coronavirus. What do you do when you just a caretaker? How do you deal with that? And people are used to you, and part of your job is taking care of others.
I'd be happy to start with that one. Speaking as somebody who's a caretaker professionally, personally, and many of my patients are as well. The first thing is caretakers usually love caretaking, but many of them also become resentful because it's such an automatic for them that they themselves and everybody around them come to expect it of them. And that automatic part leads to resentment. So the first thing I would say is, if you are a caretaker and you've chosen that, be honest with yourself and remind yourself, a lot of this is your choice. This is what you want to do, and remind yourself that you really do get a lot out of it. That will help with some of the resentment because you'll own it. And you will focus on the fact that you do it because it is pleasurable to you. And like I said, I hear this a lot from patients, but it's also me that I'm talking about. But number two, caretakers are often not taken care of because everybody relies on them for that. And that's just the way things fall out. They don't get taken care of. And many of them are waiting. They think that if they do enough caretaking, other people will see that that's what they should be done to them. And it often doesn't happen that way. So you need to take care of yourself. And caretakers have difficulty sometimes prioritizing themselves. It is essential. Do all your caretaking, but prioritize doing something for yourself. And that may mean, sometimes that may mean not doing something. Sometimes it means that too. I mean, for me right now, it's my exercise, and I live for my daily walks outside. But it means telling people what you want them to do, telling somebody what you want them to do in terms of a task or in terms of something to help you. And finally, what was I going to say? I think you need to work with yourself and ask yourself, why am I having difficulty doing something for myself? And if you can't get past that to actually do something for yourself, then remind yourself that your children, your patients, whomever you take care of, will actually benefit from your being happier. An unhappy, angry, resentful mother is not doing her children any favor. A therapist who is overstretching herself with her patients is not doing her patients any favor. So if that's the only way you can think of it, then think of it that way, that you're doing it for your dependents, and you need to place limits on how much you give. And when you feel the resentment and the anger coming up, that should be a little bell that tells you, I need to reevaluate how much I'm putting out.
I agree. I agree, and I just want to add, you know, in Soroka, we are now working in shifts of 12 hours. So the shifts are changing all the time. And a lot of times we have to send people home because people don't want to leave the shift because because they feel that they didn't finish all what they have had to do. Being a good therapist is taking care of oneself. I will remind all the time, we have a helpline for our workers, and we have like chats, and we go through the departments, and we tell people to take breaks, to take food breaks, to take time to exercise, and if you feel that you are exhausted, talk to someone. And many of our workers are afraid to say, I'm breaking down, I feel anxious, I don't have the power to do things, and we have to check so they won't be burned out, because it will take a lot of time. So we have to keep ourselves, and we have as caretakers, for caretakers, we have to check all the time that people are taking the time to replenish the like you go with the car to the gas station. You have to replenish your resources.
Thank you very much. Now we're gonna ask the participants, if anyone has a question, unmute yourself, raise your hands, or write on the chat that you have a question. You can ask for a friend. Okay.
Pazit, there's a question in the chat from Mira. Do you want to ask it, or?
Go ahead, you can ask.
What do we do when we have to get out? We have to get out to get food, to get some air. Every trip out of the house, taking the elevator is scary if you meet more people. How can you stop being so scared? That's the question.
Okay. And yes.
So maybe I can answer that. First of all, you can wear a mask. There are like a simple mask or even a scarf. A clean scarf over the face is enough. Touching the buttons, the elevator with the knuckles, not with the finger, and then washing your hands with soap and warm water. And if you are not, if there is no sink available, so using some alcohol gel, this will do the thing. And the main thing is to understand that most of the people around you are not sick, they are not contagious. Even if there are, the possibility to get it is not a big one if we are not close together. And it's also it's not a shame to ask someone to get sorry, but we have to get a little bit apart. It's not in these times. Shame is not a question. So, but also bear in mind that the possibility to get a sickness out of that is very, very rare. And most people who are sick are in the hospital or in their homes, secluded. And so the possibility is not, the problem is not there.
Okay. I have a slightly different view. The information I'm getting here is actually that many, many, many more people are infected than we even know of, and that many of them either don't have symptoms or have very mild symptoms. So I don't have a problem with sort of acting like everybody around us might be ill. And that's one of the ways that this virus is getting transmitted very easily and very quickly. But that said, we have a term in psychology called binding the anxiety. And that's a fancy term for if you're very anxious, what do you do to sort of manage it and limit it? And I think one of the best ways to bind anxiety is to take action. So because one of the things that we're all coping with right now that is very much a sense of the collective trauma is the sense of helplessness and powerlessness. So if you take the steps that Dr. Ben-Zion has just described, that you need to remind yourself that that's going a long way towards keeping you safe. When I go out now, I wear gloves. If I wear a mask, if I'm going in, if I'm not just taking a walk, but if I have to go to the grocery store, more and more, I'm ordering things online. I'm ordering things on Amazon, so I don't have to go into a crowded store. When I get a package, I leave it outside my door for 24 hours before I open it up. Then I open it with gloves. I spray the items with Clorox before I open them up. All these things are actions that you can take to bind this anxiety. And then finally, we know that too much anxiety is crippling, but a little anxiety is what we need. Usually we talk about it in terms of performing a task well, but you could consider these tasks. We need a little anxiety to sort of stay on our toes and do the right thing and just maybe embrace it. If you're finding it crippling, one of the problems with that is it becomes hard to think when you have crippling anxiety. And this is a lot of what I'm hearing from a small subset of my patients are so upset, so hysterical, that one of the things I'm doing is I'm literally helping them think things through. And if you are having difficulty with that, you might want to reach out to an online therapist who can just help you talk it through.
Okay, I agree with you, but the thing is that, as I said in the beginning, there is a big difference between being cautious and being afraid. We have to take cautions. We have to make measures to control the things, to control but being fearful all the time is very bad for your immune system. Okay, as we talked about sex, hugging, kissing, being together is a good thing for the immune system. Being too much in anxiety, too much in fear will decrease your immune system, both the immune system against the viruses and the emotional and the spiritual immune system. And we have to get into spirituality. We have to be, if praying is doing things for you, so pray. If doing meditation is a good thing, or mindfulness, or anything that can help you to decrease the level of fear, that's a good idea. But the thing is to understand it's good thing to be cautious, but it's not good to become obsessive compulsive.
May I just add, only because this is something that I feel very strongly about and I'm dealing with on a daily basis. I agree with you 100%, and that business about the immune system is very important. That said, when somebody is feeling that level of fear, where it's crippling, fear, anxiety, I use them interchangeably, they may feel even more anxious if they say to themselves, oh my God, I'm so anxious, but that's bad for me. I have to stop it, but I don't know how to stop it. If you're at that point, you must reach out to anybody or anything that can help you. If you have a person to talk to who calms you down, if you have an activity that, like meditation that works for you, great, use that. If you need to speak to a therapist, talk to a therapist. If you need to go up on your antidepressant temporarily, go up. These are unusual times. They call for unusual measures. I talk to a lot of mothers who are keeping their perfectionism up. Oh my God, all of a sudden I have to be homeschooling my kids for 6 hours a day. I also have my own day job and I let my babysitter go for social distancing. Now I'm babysitter, teacher, a lawyer, whatever. You need to lower your perfection. Oh, and I have one patient, several actually. If I let my child watch more TV, that's really a help to me, but that's bad for them. I can't do it. Lower your perfectionism right now. You need to watch more Netflix, or your kids, let them watch more Netflix. If they're not going to do as well academically because homeschooling is really not cutting it for you, they will catch up. They do not need to be as super a student as they normally are. Lower your perfectionism, get through each day, one day at a time, as they say in the 12-step program. One day at a time, control what you can, accept what you cannot control.
Yep, and I agree with you. And the thing is about perfectionism, this is not a time to go on diets. It is not a time to divorce, not a time to marry, not a time to make home decorations. If it makes you happy, that's okay. But wanting that the house will be 100% clean and 100% tidy, and children are at home, people are at home, it's a living home, that's okay. It's not a time for being on a road show. This is a time, as you said, abnormal times need abnormal behaviors.
Thank you so much. You guys gave great insight, great information. I do want to touch on, let's say we all get better at taking ourselves and we are really at a good position. But what if we see somebody we know, whether it's our partner, our kid, relative, a good friend, suffering and also resisting help? Resisting help. What can we do to support that loved person that's really seems to not be able to accept or seek support?
I think that just talking to someone, talking to his family, talking to his friends, a lot of time the problem is that people are not raising their hand and saying, listen, Charlie, I don't think that you don't look your usual self. I'm worried about you. Please accept things that I want. But there is a big problem that people are, especially people in our area, and I think also in your area, are afraid of saying something which is too personal, or it is his problem, I don't want to touch it. A lot of times people are hesitating about saying to someone, you don't look, things don't look right. I think that you have to get help. So I think to reach out is the best thing, but if someone doesn't want help, just to talk to his friends, to his family, there is not, I don't think that if you know his doctors, it's a good idea to approach the doctor, but I think that the bigger problem is that people are not willing to touch these delicate things.
Thank you, Dr. Ben-Zion. Dr.
So,
Rosenblatt.
yeah, to build on what Dr. Ben-Zion is saying, which I completely agree with, I would add a couple things. One is I'm in complete agreement about don't be afraid to say something which seems touchy or delicate. I learned early in my training that when I was doing an intake with somebody, that I could actually ask this taboo, what I thought was taboo question of, have you had suicidal thoughts? If you are really that worried about somebody, you can ask them that. They are often relieved that you are naming the unnamed, the stigmatized, and they're often relieved to answer it. Same thing with substances, alcohol, weed, drugs. Are you feeling like you are wanting to use more of that? Because that's a very big sign of very bad distress. And finally, listen. You know, often people listen more, talk less. Ask a couple of questions and then let the person talk and listen. People often feel when they're listening that they're not doing something. That is the greatest gift that you can give to somebody who's, if they're really in trouble or depressed, they are most likely feeling like they're alone, like nobody understands them. And then when they talk about their worries and what they're upset about, do not argue with them. If you say, oh, you know, you feel like a failure, you're not. You did this, 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 and this. Well, in that state, if you argue with them, they're only going to feel like you don't understand. So just start with listening.
Thank you.
I cannot agree more than that. You know, there's the saying, don't just stand there, do something. Being a good friend is the opposite. Don't just do something, stand there. Be
Right.
to tell someone, I'm with you, I hear you. Please talk to me, okay? And then, you know, God gave us 2 ears and 1 mouth. You have to listen twice as talking. But usually, like in nowadays, you don't need 2 ears because people don't listen. The problem is that we have to listen. Dr. Rosenblatt and myself, we get paid just for listening. You know, one of the biggest things of being a therapist is to learn to shut your mouth and to just listen.
And you can tell, you know, I have people, some patients that just have unimaginable problems, like, you know, a child who might be dying and you can't do anything about it medically, but you can let the person know that you can go through it with them. You can bear their pain, you can listen to it, and you can be there for them. That's huge.
That's the difference between being sympathetic and being empathic.
Right.
Okay? And
right.
Empathic is suffering with, and sympathetic is to suffer, to show someone your condolences. That's the difference between being a neighbor and being a friend.
Thank you so much. So I have another question that's going to bring it maybe to the positive outcome. Obviously, it's very hard times. We are learning so much from you about tools and a lot of food for thought. Looking forward, optimistically, looking forward, do you see the light at the end of the tunnel? And what would be the emotional reward as a society for an individual when all of this is past?
So I'd like to try that one because I've been thinking about it a lot. There's absolutely a light at the end of the tunnel. Just look at history. We just don't know when it's coming. There's never been a pandemic that hasn't ended. And I don't have the statistics, but I don't think anything's gone on longer than a few months to a year. I mean, that doesn't mean that we won't have things and some wreckage to deal with afterwards, but there is a light at the end of the tunnel. And also there's certain facts that we know, again, I'm not a doctor, but we know that when we reach herd immunity, that's going to be a big turning point. When we get a vaccine, although that's less certain even than herd immunity, and so on in treatments. But in terms of, so here's my theory about how we might change, and I don't think it'll be permanent because human nature is human nature. Human nature won't change. I think some behavior patterns will change. I think a lot of people are going to realize that we don't need to run around and travel like chickens with our heads cut off, that we'll be able to do more at home. I already have decided that I'm playing with the idea of when I go back to my office to see patients, 1 week out of the month, I may see people virtually at home. And we won't need to get on planes as often, maybe, which I think would be nice for people, more relaxing. But I also think another thing, as we have become more self-sufficient over time, we have more of our own resources. We don't need to depend on other people as much. We don't need to go out to go to a store. We're at home with our computers. Those of us with means, more means, can use services, and we don't need to rely on other people. The wealthiest people have their own planes. They don't even need to rely on on the airlines. That feeds narcissism. When we need other people, when we have to rely on other people, we have to develop more empathy, and that is the anti-narcissism. I'm hoping that that might be one thing that gets somewhat ameliorated from this crisis. I don't really have any illusions that, our basic, human nature will change, but that I'm hoping that that's something that can get somewhat modified.
Thank you.
I agree. I think that part of the things is that people will become more self-sufficient. You know that many youngsters now learn to cook. People were relying on just going to McDonald's or to a restaurant. Many people didn't have a kitchen, or the kitchen was the neglected part of the department, just to use the microwave to reheat some noodles. And people now learn to know that there are things that you can do by yourself. But looking from the hospital thing, I think that part of the thing is now people will begin to understand the importance of the hospital. Hospitals and the medical community as a whole was neglected for many, many years. Many years it was dependent on more and more on the people's own budget. And now the idea that the public health system is the solution for such things. People will learn now the importance of supporting the hospitals, of supporting the sick funds, of going to doctors, and a lot of now understanding the importance of the healthcare system, things will change. And another thing I can tell you in the hospital, one of the biggest quarrel, I was the deputy CEO of Soroka. One of the things that I did all the time is telling people, wash your hands. People that are treating patients from one patient to another have to wash their hands, and many times it was neglected. Now I think that this is the end of that. Now people understand the idea of, and I don't know if you know, before of that we had a lot of problems with visitors, with our own staff. Just washing the hands was a big idea, and now things will change. So I think that I see the light. I don't think it's at the end of the tunnel. I think we are out of the tunnel, but there are tunnels ahead, and we'll get through those tunnels more efficient and with better ideas on which turns to take.
Thank you. We're already over time, so if somebody wants to ask one last question, fine. And if not, I will ask the one final question. And thank you again for this really inspiring session. So the final question is, what are you most proud of in your job as a therapist, in everything you do for other people? What, at the end of the day, when you come home, what makes you most proud?
You want to go first?
Teresa, yeah, ladies first.
Oh, okay. I would say two things. Well, several things. I feel like I've adapted really well to this. I have my fears. I have my losses. There's a lot of loss in all of this. And so I'm not saying it's been easy. It hasn't. I have my, I said the number one challenge is that previous problems tend to get accentuated in a crisis. I have my previous problems, but I've adapted really well and even found positives in it. That's number one. Number two, I'm proud of my work. I feel a little bit sometimes with Atlas holding the world on my shoulders, because my patients and some of my friends, some of them are really suffering, and I really need to be there for them. And we have a great word in psychoanalytic psychology called holding. It's metaphoric holding. And I am metaphorically holding a lot of suffering but making a difference, sort of rising to it. And that, it's such a cliche, and it sounds schmaltzy, but it's true. When you can do that for people, it makes you feel so much better. And then finally, this new way of working, remotely and video and phone, and it's a crisis for sure, has made me work a little bit differently. And I feel really good about the fact that I've been able to adapt. The way I'm trained clinically is I share very little personal information about myself. I'm not supposed to be somebody who gives advice or, sort of reassures people. I'm helping people create their own tools and build their own muscles for dealing with their life. But I'm finding that some people are simply, they're not there right now. They're too freaked out. So I'm sharing a little bit more. I'm a little less formal. I am at times giving some steps to help somebody through, because that's a starting place for them that they can build on. So that's an adaptation, and I'm proud of that.
Thank you very much. Dr. Ben.
Okay, so I'll say I'm proud of my profession. I'm proud that I'm part of Soroka, which is the only hospital in the southern part of Israel. Like, we treat half of the country. And personally, I am proud that, you know, we save lives. We save lives, even if you don't see it in the in the TV that you do resuscitation. But in my profession, I resuscitate sex lives of people. I resuscitate couple problems. And I'm proud that people are staying in love even in times of sickness and of suffering. And I'm proud that I'm part of a community of health workers that are working in the southern part of Israel, not in Tel Aviv, not in Jerusalem, and doing good work even in hard conditions. And I want to thank Friends of Soroka for supporting us. It's not I understand that it's not a usual thing to support a little the hospital in the south, but it's an important thing. We need much of your help and support, and I want to thank you for your love and for your support.
Thank you very much. If Rachel or Jay or another board member would like to say something to conclude.
I would just like to thank everyone for participating in this. I'm actually moved to almost tears from this conclusion. It's very profound, and I'm very grateful for the way this we came together and really gave people such amazing information. And I can't wait to share it with the rest of our community and get back to Soroka and let them see how well we reflected on the matter at hand. So thank you.
And I want to say thank you for letting me take part in this and share whatever knowledge I can share to make a difference. I'm very grateful for it, and I love I love the Soroka and the idea of supporting it, and the wonderful people I've met on this board.
Amazing. So thank you, and we'll keep you posted.
Shabbat Shalom.
Next.
Shabbat Shalom. You can check out the video, will be up posted. We will share it with you. Stay in touch, soroka.org, and personally stay in touch with us. Thank you very much. Shabbat Shalom.
Thank you. Namaste. Shabbat Shalom.
Namaste.
Namaste. Shalom.
Shalom.